Olfactory bulb, olfactory nerve, we'll call it. Olfactory. Here, the small little branches are actually the olfactory nerve, but I'll probably put a sticker right on that. Cranial nerve 1, olfactory nerve. Okay. Then over here you got number 2 is the optic nerve. You can see the optic nerve right there. Back of the eye socket. Goes through the optic foramen and the sphenoid bone there. Pokes back over here. That's the optic nerve. And where the 2 optic nerves cross, what do you call that? Which you also see right smack there. The optic chiasma. So right there's the optic chiasma right in the middle. Optic nerves. I don't think optic tracts are on the word bank, are they? Okay. So never mind, but those would be the optic tracts there. Okay, then over here on either side, this is your pons right here. Big anterior bulge, which you can see in you can see on the sheep brain as well. On either side of that, number 5 is the trigeminal nerve, right there. This is a good place to ask for. Now they're not numbered on here, obviously, but this is the trigeminal nerve. It's really big, and if you follow it, it's got 3 distinct branches to it. That's trigeminal, 3. So you'd have a mandibular, maxillary, and ophthalmic branch, and they all poke through holes. So there's your trigeminal nerve right there. And then I think the only other cranial nerve that's on the word bank is number 12, which is the hypoglossal. And that one's really easy. That's the lowest origin of all the cranial nerves. It comes right off. This right here is the medulla oblongata. And you can see it's labeled number 12, so hypoglossal nerve coming off medulla. So you can see the pons on this, the medulla, 12th cranial nerve, hypoglossal. Back to this thing here, you can see trigeminal, optic nerve, optic chiasma, olfactory nerve. And then this is really good for the blood supply to the brain. If you recall, this is the common carotid artery. And the branch that stays deep and goes up through the carotid foramen is right there. So that's the internal carotid artery. You can follow it up through that hole in the floor of the skull. It comes back out over here. There's your internal carotid. And the internal carotid, one thing the internal carotid is going to give rise to branches that help to make up this circle of Willis. So this right here, right where the pituitary would be right there, and the sella turcica, and these interconnecting networks of blood vessels that kind of make a circle is the circle of Willis. So right there's the internal carotid, or right there. That's going to supply the anterior 2/3 of the brain by way of its different branches. And then going through the vertebral foramen here is the vertebral artery. There'd be a vein in there too, they don't show it. So you have the 2 vertebral arteries. They merge, they go up through the foramen magnum. They merge right there to form the basilar artery. And the basilar artery gives rise to branches that are going to supply the posterior 1/3 of the brain. So internal carotid, anterior 2/3, vertebral / basilar give rise to the posterior 1/3 of the brain's blood supply. So you got the 2 vertebrals, basilar, circle of Willis, and internal carotids. Those are the major blood supply to the brain. Okay. Back to this guy, we got the pons, medulla oblongata, and then from here on down, where the hypoglossal nerve stops, that's the spinal cord. This would be the ventral median sulcus that you can follow all the way down, or anterior median sulcus. You got the cervical enlargement in this area, although I'm not going to ask that. You got the lumbar enlargement down here. Termination of the spinal cord right there. What do you call that? L1, L2 level. That's part of the pia mater, continuation of pia. This is the conus medullaris down here, where the spinal cord ends, so it runs from here to there. Then the network of nerves that continues within that thecal sac, which is really the dura. What do you call that? Cauda equina, horse's tail. And right smack in the center, coming from the conus medullaris, number 15 it looks like. Can't really read that. That's going to be your filum terminale, is what they're trying to represent there. So the filum terminale, just a extension of pia mater, runs straight down the midline. So if it's right in the midline, it's filum terminale. If it's off to the side, it's the cauda equina. Filum terminale runs down, eventually merges with the end of the thecal sac here, or the dura, and then continues down and anchors somewhere on the coccyx. Okay, you can see the dura. I don't think thecal sac is even on the word bank, but the thecal sac just refers to the sac that the dura makes around the entire central nervous system. But this down here, you can really see the dura mater really good. I mean, you can see the dura mater really good on the sheep brain too. There's a needle stuck through it. It's really looks like kind of like a flat ligament. All right. What else do we have here? The big plexi. Up here, cervical plexus. Comes off C1 through C5 nerves. And then the much bigger brachial plexus that runs through all these different muscle groups. Supplies entire arm and shoulder. So cervical plexus up in here. Brachial plexus. Down here you've got your lumbar plexus. Biggest nerve that comes off the lumbar plexus is going to be the femoral nerve. Supplies anterior thigh musculature. And then down here you've got your sacral plexus, and this does not show you the sciatic nerve. These big bundles here will contribute to the sciatic nerve, which will be coming out down this way in back of the butt, but essentially underneath the gluteus maximus. I'll show you what we're done with here on the muscle model. You can see the brachial plexus, you can see the femoral nerve really good, you can see the sciatic nerve really good. You can't really miss it. Okay. Denticulate ligaments, the filum terminale down here from the continuation of pia, and then starting about here, looks like all these almost kind of like labeled right there and there, kind of bluish looking lateral extensions of pia that are called denticulate ligaments. They only show them on this side. They don't show them on this side to avoid a lot of clutter. And so there's really start right about here, it looks like, and go all the way down to about there. So denticulate ligaments. Then they only show you on this side as well. This is the sympathetic trunk. All this right here. A bunch of ganglia, cell body clusters, connected by branches, and it's involved with the sympathetic division of the nervous system. The upper three ganglia, these are sympathetic ganglia. These three have their own specific names. So the whole thing is a sympathetic trunk, but if it's pointed right there, we're looking for the superior cervical ganglia, which is a pretty famous one because all the neurons that supply every blood vessel in the brain originate from this ganglia right here. So if this is irritated by spastic muscles or whatever, it's a definite cause of headaches and such. So this controls the blood supply to the brain, superior cervical ganglia. It might be about everything on here I can think of.
Oh, sorry, did you say the